Hello, my name is Tiffany Love. I am the Associate Vice President and Chief Nursing Officer for the University of Vermont Health Porter Medical Center. And I have come to the conference to talk about how I bring diversity and equity to the executive suite. I shared with you strategies that are evidence-based strategies that we use every day to address issues we have in healthcare. Using SMART goals, identifying key metrics, and setting a timeline to get this work done. We are really good at doing this work. So I ask you, why haven't we set these goals to close the pay gap? Why haven't we set these goals to address racism in healthcare? I think it's time for us to address these goals. One thing that I did not have the chance to talk about is color-blindness. As we have had many talks about DEI efforts, I have noticed that some colleagues who are well-intended will say that they do not see color or that they are colorblind. I want to make sure that our audience understands that color-blindness is actually a different form of racism. When you say that you are colorblind, you are saying that you do not see the inequities in the environment that are oppressing other people. So I want to strongly encourage you to think of a different way to express being inclusive in this workspace. During the conference, there was a question that came up by a non-binary person who stated concern that we were not giving enough attention to non-binary people. And I want to say that I don't think people intend not to give you more attention. I think they have concerns or fear that they might say the wrong things. And so as we do this work together, I think it's really important that we give each other grace and understanding and know that none of us are perfect. So we may make mistakes, and we just have to move on. So hopefully at the next conference, we will feel educated enough to address more non-binary issues. Does your leadership team represent the community that it serves? The likelihood is no. There have been a number of benchmarking studies that demonstrate that the Board of Trustees of the hospital is usually less than 20% women or people of color. The senior executive level is only 15 to 17% women or people of color. The only gains we have seen in healthcare leadership have been at the frontline manager level. And while we have seen increases at this level of leadership, this is not something that we should be happy about, because we know the research shows that many of these leaders will end their career in these very same roles. We need to think of strategies to help sponsor women and people of color to higher levels of leadership, whether that be through publications, stretch assignments, awards, finding opportunities to advance our women and people of color who have equal talent but not equal opportunity. This data has not changed for decades. And so oftentimes I am the only woman and only person of color in the executive suite who is there to stand up and address equity issues. And so that makes me feel very vulnerable in this space. However, this is very important work to do. So I say that to you so that you understand that DEI work is risky for me as a woman and a person of color. However, it's very important to me. So I did share some of my strategies that I will share with you again today. My priorities in the C-suite are, number one, to close the pay gap. Number two, to create equitable opportunities for everyone to be promoted within healthcare leadership. I want to address harassment of all kinds, and I want to make sure to offer flexible work schedules. We are living through the Great Resignation, and the largest group of people leaving are in healthcare. The largest group of people leaving healthcare are women. and we need to give them a reason to stay. Reasons cited for women leaving the workforce are unsafe workloads, pay inequity, harassment of all kinds, demanding work schedules, lack of promotion, lack of childcare, lack of adult care. These are all things that we can address. And I want you to think about this. We are all competing for the same resources. We are all competing for a limited number of nurses. We are competing for a limited number of doctors. And so for every person that decides to leave the workforce, that is one less person in the pool of talent. And we are finding ourselves in a talent deficiency. And I would ask you, would you want to go to a hospital that does not have enough doctors or that does not have enough nurses? We are already having states that are providing crisis standards of care. We are telling the community we don't have enough nurses and doctors to care for you. And I don't want this to become the new standard. So I want you to make the investment in your workforce. Give them the pay raise so that they have equitable living wages. And if you say that you don't have the budget to give your staff equitable living wages, then I would say there's something wrong with your business plan. And if you don't have the money this year, I would urge you to plan this year for next year and incrementally increase the pay until you can pay all of your staff equitably. Since the pandemic began and after the murder of George Floyd, we have witnessed increased incivility within our workplaces, not just from the public, but even amongst the staff. There are employees who every day seem to have a burden on their shoulders. They are having problems with their marriages. Their workload is so heavy and their work schedules are so intense that their families are beginning to plan events without them, which is leading to burnout, which is leading to people wanting to leave the healthcare workforce because of the demanding schedules and the burden that they face when they return to work. All of these factors have led to a country that I believe is going through post-traumatic growth. People who went into the healthcare profession are now questioning whether they should stay. And so people have begun to make very serious life changes. And part of those changes are making decisions on whether they want to stay in the work environment where they are. Or are they going to go to the next organization that's offering more money, that's offering a bigger bonus, that has a better culture? As a leader, one of my number one responsibilities is to create the culture where people thrive, holding people accountable for bad behavior, and then also encouraging and role modeling good behavior. During my talk, I talked about the importance of leadership rounding. You can do employee surveys, but many employees are afraid to respond honestly because they suspect that somehow you can secretly figure out who said what. And so I find it more effective to do leadership rounds frequently. The more that you round, you will find that you will build trust and a rapport with your staff. It's important to learn their names, know what's going on in their lives. And as you round more frequently, they will begin to tell you what the real issues are in their environment. So I encourage you to do that leadership rounding so that they feel heard. Many of our employees do not feel heard, and they don't feel safe to tell us some of the things that are going on in our environment. So I would urge you to use leadership rounding as a tool. Don't go around with a list of questions as if it's an assignment. Check on your people, see how they are, how is their day going? And eventually they will begin to tell you the things that you can do to make a real improvement in their work environment. Taking a stand to be an anti-racist employer is a really big stand. I was so proud to find out that Mayo has taken that stand. I actually admire Mark Milley for stating how the federal government is an anti-racist employer. I know that is a very high bar, a very big goal to set, but it makes me feel safe when I come to Mayo to know that you have set the expectation that you are an anti-racist employer, and it makes me feel safe. And I, at my healthcare organization, have taken that same position to be an anti-racist employer. And so I think that this is just one of the steps that we all can take to make people feel safer when they come into our healthcare work environment. Not during this talk, but during a recent talk, I talked about the healthcare environment that includes harassment. So let's just say that staff are not getting along, they're arguing, they're fighting, or maybe it's even sexual harassment. Can you imagine the mental stress and burden of being harassed in the workplace, feeling unsafe in the workplace? What if you work in the emergency room? What if there's a code and you have to work side by the person that you're afraid to work with? This is an unsafe environment. The Joint Commission realized this a long time ago. They have issued a Sentinel event alert for harassment in the workplace. And so I urge you, if you have an environment where people are complaining of harassment, it is of urgent importance to address it. Otherwise, you are allowing an unsafe environment for your community. And I would never want to go to a hospital that had a toxic work environment. If we say that we want to have an anti-racist work environment or even an anti-racist healthcare system, we have to remember that we are discussing structural racism. And structural racism will require systematic interventions. This means policy change. We know that our healthcare system was built on a reimbursement system that essentially means that if you live in a wealthy neighborhood, then you will go to a well-funded hospital. If you live in an impoverished neighborhood, then you will likely go to a safety net hospital that is underfunded, where the staff may not have protective personal equipment. The research shows that during the pandemic, people who worked in skilled nursing facilities were twice as likely to die. We also witnessed that many of the patients also were twice as likely to die. If you worked in a hospital, there was a 30% chance of you dying. However, if you worked in an academic institution, you were pretty much safe. The reasons suspected were lack of PPE, lack of funding, lack of ability to get the resources that staff needed to do the work. And so I think we need to really seriously scrutinize our current reimbursement system so that we can address these inequities, so that people who live in underserved neighborhoods have the same chance of survival as people who live in higher income neighborhoods. During the pandemic, as I started to deal with the grief of the death of George Floyd, I realized that going home and crying every night was not really a solution. So I decided to re-educate myself on what the issues are that we're experiencing in our country. And I reread the book by Martin Luther King, Where Do We Go From Here? Chaos or Community? And I realized that we are dealing with the same issues that Dr. King was trying to address because we never truly addressed them the first time around. And so this is a really great opportunity for our country to do the work that needs to be done so that we don't find ourselves in the same place a decade or 2 decades from now. I also read How to Be an Anti-Racist, White Supremacy in Me, White Fragility, White Rage, The Color of Law, The New Jim Crow, all to educate myself on what is going on in the world around me, to help make sense of the perspectives, the diverse perspectives of the people in our country, people who feel disenfranchised, and people like myself who don't feel safe in anyone's neighborhood, whether it's a rich neighborhood, a poor neighborhood, a white neighborhood, a Black neighborhood. As a woman and a person of color, I've never felt safe. And as we're going through this week with the trial of the young man who was killed in Georgia, I often think about the fact that I have never in my life felt safe walking down anyone's street. Our children should not have to grow up in that environment. So I think it's time that we do the work so that they feel safe. One of my goals is to develop the pipeline of diverse leaders to the C-suite. It's very important that we have individuals at the highest level of leadership who are representative of the communities that we serve. Why? Because these are the people who are making the decisions about pay data. Who gets a raise? Who doesn't? Who gets promoted? Who doesn't? If there is a complaint of harassment, will we do an internal investigation? Or is it so serious that we need to bring in outside counsel? We are making decisions about the services we will provide to our community, which has a direct impact on the health of our community. And so as we make the decision to serve, to provide a service or not to, it's really important that the people who would be impacted by those decisions are represented in those meetings. Many women and people of color have graduate level degrees. They will be promoted to the first level and mid-level leadership roles, and that is where they will spend most of their career. So as you are deciding who gets the stretch assignments, who gets the sponsorship, please think about having an equitable process in place so that when you give these opportunities, everyone has a fair chance to be selected and to rise to the C-suite level. During my talk, I mentioned the gender pay gap. At some point in time, someone told us that women would have to wait 100 years for us to close the pay gap. I want to challenge you and ask, why did we accept that information as fact? We have the skills to strategically address the pay gap. We have strategic plans that are 3-year plans, 5-year plans. Why can't we plan this year to start closing the pay gap next year? Asking a woman to accept that it will take 100 years for her to have equitable pay is unethical. So please think about how you can close the pay gap at your organization. Diversity, equity, inclusion, it is a core competency of leadership. And as you do this work, I want you to remember that when you create an environment that is safe and equitable for women and people of color, we all thrive and we all rise. Thank you.